Hi, this is my complementary and alternative medicine. Um, I chose EDTA chelation therapy. Um, it stands for ethylene diamine tetraacetic acid. The introduction. Chelation therapy is a chemical process in which a substance is used to bind molecules, such as metals or minerals, and hold them tightly so that they can be removed from the system, such as the body. It removes harmful minerals such as calcium and other minerals that are the cause of cardiovascular problems. Some history on it. Chelation therapy was first used in the 20th century to treat lead poisoning. They administered a drug called chelator that helped grab metals and held onto them tightly and was excreted by the urine. The EDTA chelation therapy was used for patients with heart disease since the 1950s. Some indications for usage. It removes heavy metals and minerals from the blood such as lead, iron, copper, and calcium. It's also used for lead poisoning, hypercalcemia, iron overload, toxic metals, heart disease, diabetes, and it also helps to reduce cardiovascular events such as heart attacks. Some side effects and adverse effects I found. Some common ones are burning sensation to the IV area as is administered. Some rare ones are fever, headache, nausea, and vomiting. Rare, more serious adverse effects is heart failure, sudden drop of blood pressure, abnormal low calcium levels, permanent kidney disease, bone marrow depression, and such as I said, hypocalcemia is a big one because people die from the hypocalcemia and chelation therapy. The course of the treatment can require 30 or more infusions for many hours and taken weekly, usually given with high added of vitamins, antioxidants, and mineral pills. More information about the chelation therapy. The EDTA is not approved by the U.S. Food and Drug Administration to treat heart disease, but it is approved for lead poisoning. Studies show a reduction in cardiovascular events, but more studies are needed to know whether it's a treatment option for many people. A culture that might benefit from the chelation therapy. A culture such as non-Hispanic whites, non-Hispanic blacks, and American Indians. According to the Center for Disease Control and Prevention, CDC, these cultures have the highest risk for heart disease. Because of this, I believe that chelation therapy will benefit these culture groups. It's used for people with heart disease and it also prevents complications from the disease. As studies show that EDTA has a reduction of heart and cardiovascular events. Some general health teachings for this would be to teach the patients the pros and cons of the therapy, letting them know, if it's worth doing or not. the amount of time for each session of the therapy. If they want to spend the time doing it, they have to know it takes some time, and they'll have to go in weekly for a while. So they need to weigh those outcomes. And also they need to be taught the side effects, the rare and common side effects. You know, rare is rare, but it's still a possibility that it can happen to them. I found a research article on the chelation therapy. It was a double-blind, placebo-controlled. There were 1,708 post-myocardial patients. They're all 50 years of age, over 50 years of age. Randomized EDTA chelation or placebo. They had to have MI prior 6 weeks. So there was 4 groups that attended the clinics quarterly, and they were seen at the end of the trial, 5 years for the follow-up. And in conclusion, in stable post-MI patients on evidence-based medical therapy, the combination of oral high-dose vitamins and chelation therapy compared with double placebo reduced clinically important cardiovascular events to an extent that was both statistically significant and of potential clinical relevance. And these are the references I used. Thank you.